Hola Cris, buenas noches.
Teacher, buenas noches.
¿Cómo estás, Cris? Mil disculpas, mandé a un grupo equivocado el enlace. Lo siento mucho. No sé si podemos charlar en otra ocasión. Este es otro curso, por favor.
Ok, teacher, ya se me hacía raro, no se preocupe. Está bien
Muchas
que
gracias.
charla después de tanto
Que te
tiempo en
vaya
línea.
muy bien.
No, usted.
Chao, chao. Okay, good night, everyone. I'm so sorry. I sent by mistake our link to another group, so I don't know if you can listen to me.
Yes, yes.
Okay, thank you. And can you watch my screen?
Yes.
Perfect. Continue then. Remember we had a homework about some definitions of word. Who can start telling us about the definitions of that word? Hello? Alejandra Macías?
Yes.
Did you remember we had a homework?
No, but I remember some things about the last class and about the nurse manager, or have other name. Maybe we know this kind of nurse like a partera.
Okay, yes, we were talking about matron, right?
Yes,
And
matron.
I asked you to find out another definition or the correct definition. Maybe we can find out which is the correct definition for this word. Okay. So what else do you know or do you remember?
This kind of nurse have the most experience in the area.
Okay. Okay, someone who is experienced in this area. Carla Barta. Thank you, Ale.
Okay.
Good evening, Miss.
Good evening. Do you have another definition or do you want to add something else?
Well, I look for another word, maybe midwifery.
Okay. Yes, it can be something like that because midwife is someone who helps a woman to give a birth, right?
Yes.
But that's why we are talking about this word. We're gonna find out today which is the correct definition. Okay? Perfect. Thank you, Carla. Jethro.
Yes, teacher. Good evening.
Good evening. Do you have something else to add?
I'm looking for the same words and same definitions, teacher. Like Carlos says, my wife. I look for this word.
Okay. Okay, thank you. Jorge Brun.
Yes, good evening.
Good evening. What about you? Do you have
Well, actually,
another definition?
yes, today, like, I saw something, then I read that, like, this is like a kind of a specialty nowadays for a registered nurse, and they have like master degree that belongs to this kind of specialty called matron, and they're in charge like kind of registered nurse to work with obstetrics patients.
Okay, so now this kind of woman or it can be a technician, do you say?
Yes, I saw that today. I read that
Okay.
this morning, but I think like it used to be like more empiric, like an empiric job.
Yes,
But in the
it
past.
used to be.
Yeah.
Yes. Okay, and do you think a midwifery it could be considered a matron, or there is a difference there?
Can you repeat that, please? I can't hear you well.
Yes, a midwifery is the same as a matron, or it would be a difference?
I think that there might be a little difference.
Okay, could you say to us which one is the difference?
As I said, I think like like first you apply for license to be a registered nurse, and after that you get that master degree to become a matron. I think there's the difference. I don't know.
Okay, yes, but both help women to give birth, right?
Right.
A midwifery could be less less related to a university degree, maybe than a matron now,
Okay.
right?
Yeah.
Okay. That's the little difference, because
Okay.
both does the same. Okay. Well, anyone else wants to participate or say something else? I think we have the correct definition, right? Or is there a doubt here?
Maybe I can add that I read like one more definition, that a matron
please.
will also be in charge of women and children at a prison or at a police station, not just a hospital.
Okay. Okay, thank you so much, Sergio.
You're welcome.
Perfect. Is there a doubt now? I think we have a good and a specific definition, right? I think we can continue. So, please, Carla Calle, can you help me reading?
Yes. Support workers. The clinical support workers who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified, both assist nursing staff. There may also be ward clerks who that is include making sure patients' notes and informations are up to date and answering the telephone.
Okay, thank you. So we have the support workers. This clinical support worker is the one who has done a short course and obtained basic qualifications, okay? And the nursing auxiliary is usually unqualified, but both of them, the support worker and the nursing auxiliary, assist nursing staff. Okay. There may also be ward clerks, whose duties include making sure patients' notes and information are up to date and answering the phone. Okay, so do you understand the ward clerks meaning?
Yes.
Would you help us to understand better?
Maybe a ward clerk would be a supervisor or supervisora, but in the nurse staff, in the nursing staff. I don't know if it's correct.
Could be, but it's more like empleado, okay, de sala.
No, okay.
It's more like that, okay. That's why we said that they are usually unqualified, but those are support workers. Okay, in order you can understand. Those people, of course, are important on the job they did, but of course they are not nor technicians nor doctors. Okay. And do you have any other questions here? No questions? Okay. Jorge Brun, please help me out here.
Sure, okay. Specialization, like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, management of pregnancy and children. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness.
Thank you. So we have the little and specific definitions, right? We can say that a midwife has specialized from the beginning by doing a course of midwifery. That is the management of pregnancy and children. In other words, they help women to give birth. District nurses are those who visit patients in their homes. Health visitors also work in the community, but they are giving advice on the promotion of health and the prevention of illness. Okay? I don't know if you have any questions here. Can we say that we have in our countries this kind of nurses? Or not?
Here in Ecuador, we have those.
The three of them?
Yes, as I told you in the last class, a midwife is like an obstetra who is qualified. And in the rural areas, we have midwives also. And these district nurses, I think, are the nurses, but we have here a staff of conformed by a doctor, a nurse, and it's called TAP, técnico in primary care. And they go home by home.
Okay, thank you so much. And those health visitors, or it's not separated? I think most of them works with the community, right? They are giving advices and promotion of health and prevention of illness. But I don't know if in your countries you have this like a separate staff. Nobody? Mateo Chavez.
Yes, sorry, I can't understand you very well. It's some kind of noise in the background of your mic.
Okay, so do you want me to repeat the question?
Yes, please.
Of course. I was asking you if you have in your country these three types of nurse. I don't know if there are the differences in those three areas in your countries, or there is just one that make everything.
Okay, so I think the district nurses are common here in Bolivia, mostly in private practice, because I don't know. It's like the nurses obtain their degree, and they work like district nurses. I haven't seen many health visitors working in the community. I think that most nurses may do the work, everything, right? Like as a midwife or health visitors, anything they are meant, like they told they are told to do, right? And I think just the district nurses can be differentiated here.
Okay, thank you, Mateo. Rina Rodesno.
Yes.
What about you?
Well, here in El Salvador, there is a different specialization for the nurses, and according with the text, I can see different kind of study. For example, I don't know in English, technologo. I don't know how is say in English, technician. Okay. There is a different level of the study. The first is a technician in nursery. The second, it's a bachelor. And another one after the bachelor, there are different specialization, for example, for surgery, or I don't know, asistente de cirugía or asistente de sala. I think that is the name. Another one is the area of the administration, and and la jefa de área. I don't know, the boss of the area, I think, in the different department of the hospital. And yes, like that, I know, but I don't know if in my country there is another person that the text says, that is the name, support worker. I think there is no profession, the support workers. I don't know what is the name in Spanish about the support workers. There is no nurses.
Support workers?
Yeah,
or health
support work
visitors.
But that person is not a nurses.
It could be here, for example, in Bolivia. I don't know in other experiences, and I want you to tell me, but in my experience, I work in the Ministry of Health, and we have just one kind of nurses that used to make a lot of stuff, okay? Of course, there are the manager of the nurses, we have the auxiliary ones, and we have a midwife. Then usually these health visitors, it's done by the students who make the internship. Okay, they go on the rural area and talk to people, giving advices on the promotion of health and the prevention of illness. We used to go to some schools too. I don't know, called here ferias de salud, for example. We make promotion, but it's not only by the nurses. with the dentist, they go with the general, the doctor, okay? And I don't know, I was thinking that maybe in your countries it will be the same. What about other people from Bolivia? What do you think? Yes, please.
Maybe here in Bolivia, we don't have doctors or nurses with this kind of specialization. Maybe in the rural area, we have the general doctors and nurses, but the principal is the internship or doctor junior with the internship in medicine or nurses and odontologists too for do this kind of work, visit the patients in their homes. But the midwife here, we don't have a person with this specialization. It's just a woman with experience.
Okay, thank you so much, Ale. That's right. Maybe, I don't know, it's a little bit invasive. Of course, dentists won't do the same job as the doctor, but in the other cases, like promotion of health and prevention of illness, everybody works, right? Okay. Any questions here? Any doubts or something you want to add? Nothing? I think we can continue. Where was I? Sergio Burgoa. Could you help me here, please?
Yes, yes. The nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressure, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following article demonstrates. Nurses carry out surgery in effort to cut patient waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts.
Thank you. So, do you think it's true? This, what this article says? In other countries, they are specialized, right? I don't know who wants to give an opinion. Hello?
Hi, I think that is true. In fact, the nurses have a big job in the hospital because I always believe that the nurses is the main personnel that stay in the hospital and learn a lot in a specific area because the doctors turn or change the areas, but the nurse is the person who stay in a specific area and knows the patient more, like the doctors. In fact, it's a big help. Beside, with the article, I read in another countries that is true. The nurses have another responsibilities that it's good because the nurse, the doctors, the helper workers are a team. So I believe that is true and it's very, very useful for everyone.
Okay, thank you so much, Rina. I don't know who else wants to add something. Or maybe, I don't know, give some experience.
In my experience at the hospital, yes, nurses are like very, they're like very active in their roles, uh, helping doctors, maybe even not prescribing drugs, but maybe assisting doctors in many things and suggesting things and giving recommendations and doing maybe basic procedures, but they are very active in many roles involved in at the hospital.
Okay, Sergio, thank you. I agree with you. Anyone else?
Yeah, I would like to add that I agree with you that some nurses have a wide experience, and but I don't think here they can prescribe drugs or the laboratory tests. But in developed countries like the United States, I know that there are like a specialization. For example, with there are nurses that have specialized on anesthesiology, and they work like anesthesiologists. So that's something we never saw here, but it happens in the US.
Thank you, Jorge. That's right. What happens here is that most of people or most of these kind of nurses that can help us, they just got experience, right? Because they were working a lot of years into the area, so of course they will learn something. And it happens that in some places, some health centers, the little ones or the small ones, if some people or some doctors just go maybe 3 days in a week, I don't know, and they go out, especially in the rural area. In my experience, it happens. Not every time, but yes, sometimes happens. It shouldn't be like that, but it happens. And that's why the auxiliary nurse or maybe the student, even the student, has to do some other work, extra work that of course they don't have to do because they are not prepared. Okay, but it used to happen. I don't know if you had that kind of experience or you saw something like that. Because it happens that to me on my rural year. That's why I'm telling you. But I don't know if you have the same experience or you saw something like that. Nothing. Okay, let's continue. Valeria Mercado.
Good evening for everybody. And
Good evening.
well, the verbs performed and carry out are used with all types of procedures. They are often used in the passive form. Perform or carry out an examination, carry out an operation, carry out a procedure, carry out an experiment, or perform a test, perform or carry out a biopsy. The procedure was performed or carried out by a nurse.
Okay, thank you so much. So we have two verbs here, perform and carry out. And both are used with all types of procedure. They are often used in the passive form, like perform an examination, perform an operation, carry out a procedure, or perform a procedure biopsy. We can also say the procedure was performed by a nurse, or the procedure was carried out by a nurse. To explain what was the procedure. Do you have any questions here? Is it clear?
Yes, it's clear.
Okay. Thank you. Let's continue. Okay, Weimar. Weimar, can you help me here? Good evening. Could you read this part, please?
Yet health professionals, community health. The health of the community depends of larger number of people other than medical practitioners and nurses. This can be grouped under the heading of LIOT. Health professionals, they include the following.
Okay, thank you. Allied health professionals. The community health is the health of the community that depends on a large number of people other than medical practitioners and nurses. Okay, these can be grouped under the heading of allied health, who the health community that depends on a large number of people other than medical practitioners, okay, and nurses. And they can include the following. Okay, we have the technicians. I don't know if Jocelyn is here. Jocelyn, are you here?
Teacher, good evening, teacher.
Yes. Could you read this part, please?
Okay, teacher. There are numbered technician people and work with scientific equipment to radiographers are known as X-ray technique, ambulance technique, work in the emergency service, and ambulance technique with more advanced qualification is called a paramedic.
Okay, thank you. Well, we have the technicians. There are numerous technicians, and those are people who work with scientific equipment, okay? Such as radiographers. These radiographers are known as X-ray technicians. We have service, an ambulance technician with more advanced qualifications is called a paramedic. Okay, and technicians here in Bolivia. Who knows?
Sorry, I couldn't hear you. It was a lot of interference. Could you repeat, please?
Yes, yes, of course. Do we have a paramedic in Bolivia?
Yes, but I think that paramedics here are not so well trained that in the first word, you know. I think the paramedics here, maybe in the Red Cross, or I don't know, but in my experience, the people who has the first approach to the patient in an emergency don't have the right skills to stabilize a patient to bring it to the emergency care unit stabilized, right?
Okay, Mateo, thank you so much. Another one? Please agree or differ?
Yes, teacher. Well, in the hospital, there are different group of technicians, like the paragraph, for example, the X-ray technicians. I see a lot. There are the people who works during the night, and the technician of the ambulance technicians. In the hospital, in the second level of attention, I know that that be an ambulance technicians, and the paramedic. Yes, there are in my country. And another one, I don't know is the name, but it's a technician that works in the maternity area. That person take care of the newborns. I don't know. I know that it's technician, but I don't know exactly the name. But there is another type of technicians.
Okay, thank you, Rina. But do you have a paramedic like with that name in your country?
I'm sorry, teacher.
Rina?
I can hear you, teacher. There is a interference. Can you repeat,
I'm
please?
sorry. Yes, of course. I was asking you if you have in your country in El Salvador paramedics like that name. There is a group, a specific group that called paramedics.
Yes, there are different groups. The paramedics, I think that is very popular. That is the paramedic of the Cruz Roja. Yes. And another one of paramedic is the another GNO, like a fast care or Cruz Verde, for example.
Sí, las dos grandotas no corté. ¿Tú no te la ibas a jalar?
Okay. Perfect. We have here Cruz Roja. Sorry, can you listen to me?
No,
Or not very
teacher.
well?
No, miss, no, it's not clear.
Teacher.
I'm so sorry. I'm losing my signal. I'm losing my signal. Traveling, as you know, I'm in a rural area, so yes, I have some trouble with the signal. But we can continue. Please be patient with me this week. I will have maybe some trouble with the connection. But if you have any other questions, you can write into the group of WhatsApp and we can solve it, okay? Don't you stay with the doubt. Let's try to advance a little bit more. And then I will send to you my questionnaire. And tomorrow we will have our first practical class, okay? Okay. I don't know who can help me with this part. Sergio, please.
Yes. Prosthetists and orthotists. Prosthetists and orthotists provide care for anyone who needs artificial limb, a prosthesis, or a device to support or control part of the body, an orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prostheses provide artificial replacements for patients who have had an amputation or were born without a limb.
Orthotists. Do you have any idea? Who can tell me what is an orthotist in Spanish?
Ortopedista.
Exactly. Thank you. Okay, do you have any question of vocabulary here?
I don't
I think
think
it's
so.
pretty much clear, right? It's for patients who have limb. Sorry. Okay. Can you listen better? Can you listen better now?
Yes, we can hear you.
Okay, thank you. I'm having this problem here. But, well, I was telling you, do we understand what is a prosthesis and an orthotist, right? Both provide care for anyone who needs an artificial limb. Okay? Let's continue then. Here we have our orthotists provide a range of splints and other devices to aid movement, correct deformity from an abdominal development of part of the body. For example, club foot, okay, or talipes, and relieve the pain. Here we have a device to add movement. We have those kind of devices. Okay. Do you have any questions of vocabulary here?
Me?
Do you understand what is a... Yes.
I have a question about the vocabulary. What is talipes?
Leaves. Okay. This is a development of part of the body. For example, club foot. Okay. We call club foot when a boy or a child born with some trouble in their feet. Okay, we call it in Spanish pie quinobar. I don't know if you heard about this. I think you have. Do you listen?
Yeah, when the food is not right, it's a trouble in the foot of the patient.
Sorry, can you repeat, please?
Yeah, the piequinovaro is when the patient have a problem in the foot. It's not right. It's maybe to the left.
Yes.
Sometimes.
Yes, that is correct. Okay, and that is Talib's. Thank you. Maybe someone couldn't listen to me. Okay. Okay, we're having some trouble with this class, my signal. I will send to you my questionnaire, please. I will ask you to fill all the, can you see my questionnaire?
No, teacher.
Oh no. There might be a possibility that, oh, I think you can now. Yes?
Yes, teacher.
Yes.
Oh, thank you. Sorry, I will have trouble with my signal again. I'm so sorry about these days. Please be patient with me because I have to be here for 3 more days. And of course, my signal is so bad. I will try to do my best to make anything possible to give a good class for you, okay? But like I was telling you, if you have any doubt, please write into the group. And if you're ashamed to do that, you can write to my personal, okay? And I will solve your doubts. And okay. Who's missing? I need 5 more. Please, who's missing? Every
Teacher, we can hear you.
guys. So, okay, now can you listen to me?
A little, teacher.
Okay, I was asking you guys who else
No, teacher, we lost you.
okay, now can you listen to me?
A little, teacher.
Oh, sorry. Thank you so much. Thank you, Karina. Okay. Is there anyone else? I think I have 13 on my class. Who didn't fill my questionnaire?
Yes, teacher, I finished.
Okay, thank you so much. And see you tomorrow, okay? Do you remember your schedules? Please tell me that you remember your schedules.
Yes, teacher.
Yes, teacher.
Yes, I do. Thank you. That's enough.
Okay, thank you. Thank you, guys. Okay, perfect. Then see you tomorrow at 7 o'clock. I will start with the first one.
Okay,
Okay,
perfect.
teacher.
Thank you, teacher. See you.
Thank you. See ya.
I think that's all. If you have any doubt, my personal, thank you so much. Bye-bye.
Bye. Good night.
Thank you, teacher.
Good
Bye.
night.
Goodbye,
Thank you.
teacher.
Goodbye. Thank you.